Hi, my name is Kanon. I am a rheumatologist from Thailand. On behalf of my colleagues, I will be giving a brief overview of our recent paper, Prevalence, Risk Factors, and Outcomes of Gout Flare in Patients Hospitalized for PCR-confirmed COVID-19. In this study, we wanted to learn about the characteristics and outcomes of gout flare in people hospitalized for COVID-19, and then explore factors that could be linked to the risk of flare and its outcome. We hypothesized that gout flare might be more frequent and more intense in people infected with the coronavirus for two reasons. The first reason is that gout control was reported to be worse during the pandemic, which might put the patients at higher risk for gout flare. The second reason is that coronavirus infection could activate inflammasomes, which were major drivers of inflammation during gout flare. Our study is a retrospective cohort study, which included patients with gout who were hospitalized for PCR-confirmed COVID-19 in 3 centers. We reviewed more than 8,000 admissions and identified 146 people with gout, 18% of whom developed gout flare. The majority of our patients were male and ethnic Southeast Asian. The most common comorbidities are diabetes, obesity, and myocardial infarction. People who developed gout flare had several indicators of poor gout control. Compared to people without flare, those who developed flare had lower prevalence of urate-lowering therapy and gout flare prophylaxis use. They also have higher serum urate level and higher prevalence of tophus. We explored factors that may be associated with the risk of gout flare using lasso selection and logistic regression. We found that being classified as high risk by the Gout 36 rule was associated with gout flare with odds ratio of 5.4. The Gout 36 rule is a simple 4 items tool that helps clinicians identify people who are at high risk for developing gout flare during hospital stay. Classification of high risk for flare requires at least 2 out of the 4 items, shown in the right side of the screen. Gout flares in our cohort occurred around 7 days after COVID-19 diagnosis and usually lasted 3 days. The majority of episodes were affected only one joint, with ankles as the most common joint. 1/3 of gout flare episodes were quite severe, requiring more than 1 anti-inflammatory agent. Finally, gout flare adds at least 3 days to the hospital stay. The association between gout flare and length of hospital stay was significant, even after adjusting for comorbidities, demographics, and COVID-19 factors. In conclusion, gout flare developed in 18% of people hospitalized for COVID-19, especially those with poorly controlled gout. Gout flare during COVID-19 can be very intense and leads to longer hospital stay. High-risk individuals may be identified using the Gout 36 prediction rule. A full paper can be accessed from the journal's website. Thank you.